guys, it's LaDonna and May. We're estheticians here, and we're just responding back to an overwhelming response of questions that we had from our Wednesday spotlight, and that was the skin pen. We announced that we do have the 3rd generation skin pen, and we're so excited about it. And so we had lots of emails and calls with questions, so we thought, why not sit down and go over a few of them, and if you have any other ones that we haven't touched on, please feel free to call the office at 281-313-0555. We offer complimentary consultations, so we'd love to have you in if there's anything that we don't touch base on. First question, May, what do you have?
I would love to know if it's possible to work out day after microneedling, after when I just received the procedure.
Okay, so that's a great question. It's a question we get a lot. We get a whole lot of. We want you to work out before you get the treatment. After the treatment, we want your skin to be away from any bacteria. We know the gym, it would be the worst place for that. That's one reason. Clean skin, keep your hands clean off of your face. Also, heat will activate melanin. So that could create hyperpigmentation, aka brown spots. So if we're trying to treat that, and that's counterproductive. So
to rest day of the treatment, and
yes.
Also take it a little bit easy.
Yes.
Next day also to
Yes.
to just give good response to the treatment.
Absolutely, and sunscreen. Sunscreen's a must when you're doing anything like this. You absolutely have to remember that we're delivering 1,600 microchannels per second in a depth of 0.25 all the way up to 2.5 with an adjustable tip. So depending on how deep we're going, and everything is very customized with every treatment, we want to make sure that we're going to err on the side of caution. So
then always we get all these questions also to what's a downtime?
Downtime is great. I think that's why it's one of my most popular and sought after treatments. The next day or the day of, you feel like you have a sunburn or a windburn. It feels warm. It feels very tight. Women like that feeling. The next day, it's still a little red, but you could absolutely put a little powder. We say maybe mineral powder to tone down the redness and go right back to work. About day 3, you start to get some peeling. It's not terrible peeling. I don't think it's tolerable.
Just the flakes.
It's not anything that's going to put you out of work. It's flakiness. We will absolutely create a protocol for you to keep that under control, but that flakiness is good. It is not your typical glycolic treatment or peel where your face is falling off and shedding like you would think. It's very, very tolerable. So it's just a couple days.
And then also adding to that too, the cornea side starts lifting itself, is giving very good exfoliation to the skin. The skin is regenerating new skin under that cornea side, and helps our skin to get also healthier also too.
Another thing too though, when you're creating these microchannels, the moisturizers deliver so much faster. So that's how the skin is able to heal.
That's true.
Absolutely, especially if you do the treatment with PRP. The platelet-enriched plasma, if you're infusing that, it heals at a very rapid rate. So that's to keep in mind.
And then also we get other questions what type of skin or very thinner skin can get this treatment too.
Right. So yes, with the adjustable base, as I said, it goes down a 0.2 to a 2.5. The thinnest of skins, we can absolutely bring that down, and
they get lots of benefit of it because you are building that
we're promoting collagen at their depth, so yes, it's definitely safe for all skin types and all skin coloring, African American, Indian, Asian. It's wonderful because a lot of the treatments with the glycolic acids and so forth, we have to really watch and prepare and build them on hydroquinone for weeks at a time. So that's the beauty of this treatment. We do not have to prep you with retinol or hydroquinone.
There is no preconditioning basically.
Right.
It's any skin type can get the treatment.
Right. Yeah, any Fitzpatrick. So it is absolutely wonderful.
Anything you'd like to add on?
I get questions, can my teenager or teenage son or daughter receive this treatment? Are they too young? Absolutely not. As long as they don't have active acne, we can go in and we can really, if it's just, sometimes it's just the cheek area or, different parts that have scarred, we will treat the whole face because it is your tip. We don't just go in and isolate one area. We'll take advantage of that. But we can isolate areas, and it does wonderful because it breaks up the scar tissue and collagen blooms and forms. So, yes. One big question we get all the time is, does it hurt? If any of you guys know, May and I, we have sought after the most effective, brilliant numbing cream there is out there. So,
yes, we make sure to use really good numbing cream. We normally put 30 minutes, we leave on the skin gets completely numb. You don't feel any of the treatment, it's very, very comfortable. Sometimes just like very minimal feel you get on maybe forehead, but the rest of the skin is very, very easy. And we have patients who they tried it, they love it, and they come back. We recommend 3 treatments back to back with 4 weeks apart. And if just depends really to the skin how many treatment we have to really do. But if anyone they never tried, they can try only once, and after if they like it, they can just purchase it. Actually, we have packages available also too with very good prices.
We do, and the one part I can say is the forehead hardly never gets completely numb. It's skin on bone, so we do turn that down. We don't have to go strong on the forehead a lot of times. We can treat wrinkles at a higher level, but as far as comfortability, I've never had anyone that couldn't tolerate it. However, I do have clients come in that say that they've gone other places and it's so painful. There are many, many, many devices out there, and Bellis being the only FDA approved device, and the way that it is manufactured, sanity alone, sanitary purposes alone is the tip goes down and it locks into place, so it can never be reused. That's important, and the needles are very strong.
Very sharp.
Yes, the oscillating effects. It's 7,000 RPMs per minute. That's huge. So some of the devices, I know the needles are thicker and it creates a lot of injury. We don't want to break down collagen. We want to promote and build it. So, so I think we covered that. Does it help with hyperpigmentation? We hear this all the time because hyperpigmentation is a huge issue living in Texas. We're all very, very exposed to sun, and as you get older, you get the effects of that, and hyperpigmentation is one of them. So,
yeah, I see actually a good improvement on the hyperpigmentation even with one session. And also we have a product we recommend patient to take home, and helps a lot with the melasma, with hyperpigmentation, with the
bleaching pads
phototamaging.
are amazing. We can't keep them on the shelf.
They go so fast, and
Yes.
if you guys have any more questions, please give us a call back at 281-313. Me and LaDonna, we try our best here to, as a skincare wise, to help you guys. Just please feel free just to leave any comment you have in the below, and just definitely get back to you guys. You guys have a great day.
Thank you.